I'd like to welcome you to Orthopaedic Hospital. This is our centennial celebration. We were founded 100 years ago. It began as a clinic for children with crippling disorders in 1911. It was founded by Leroy Lohman. Leroy Lohman was a very special person. He had come out to California from Indiana, where he had a bachelor's degree but no medical degree. He worked at odd jobs. The information we have is that he arrived here with somewhere between $2 and $10 in his pocket. He drove a milk truck. He convinced the dean of the University of Southern California School of Medicine to let him go to medical school. He had to take a couple more undergraduate classes in sciences, did well in those, and went to USC and graduated. He did his internship at California Hospital, and then he decided he wanted to go into orthopedic surgery. Well, this was very different back then. Orthopedic surgery only had one training program back in Boston. And that training program, instead of being 5 years like it is today, was 3 months. So Dr. Lohman went back to Boston, studied orthopedic surgery, came back out here, and had a vision that he wanted to take care of children with crippling disorders, which is what orthopedics was about in that era. The word orthopedics means straight child. The field was devoted to children. Now it is about equally devoted to children and adults. But back then it was just children, and children with crippling disorders. So Dr. Lohman was a good recruiter. He recruited a group of volunteers from his church, the First Congregational Church of Los Angeles, and those individuals, primarily ladies, formed the Crippled Children's Guild, and they helped him in the clinic. But that wasn't enough. He wanted to build a hospital, to have a real orthopedic hospital where he could care for children with very serious disorders, polio, birth defects, osteomyelitis. So he convinced his landlord, where he had his medical office, to donate the Singleton estate. At that point it was 3.5 acres. The estate had had a couple of fires. All that was left was a carriage house, but what a carriage house. It had these wonderful oak stalls and beautiful tile floors, and it had ponds, lily ponds, on the estate. So there was a catch. John Brockman, who donated the estate, told Dr. Lohman he could not keep it if he didn't raise enough money to build a real hospital in 1 year. So it was a challenge grant, something unique in that era. So Dr. Lohman developed or recruited a board of trustees, and the board of trustees started work raising money with Dr. Lohman. Well, that was World War I, just the start. And typical of Dr. Lohman, he went off and enlisted and served as a physician in World War I. But the board stayed active and raised the money, and they were able to keep the estate and started construction on the first hospital, which was completed in 1922. That's an interesting year, because that was the same year that Shriners Hospital for Children completed their first hospital in Shreveport, Louisiana. So Orthopaedic Hospital in Los Angeles, Shriners Hospital in Shreveport, very few such institutions in the United States at that point. And Dr. Lohman recruited outstanding physicians, trained other physicians, and the whole situation evolved through the first half of the last century, providing outstanding care to children with a wide variety of crippling disorders, regardless of their ability to pay. There was no health insurance in that era. You either had money and paid for your health care, or you were dependent on charities. Well, this was a charity. And just like the hospital, it was supported by people who believed in the mission, who wanted to donate money to support what Dr. Lohman was doing and what his other doctors were doing. So it was very successful. It was one of the favored Los Angeles charities in the first half of the last century. Mid-century, everything changed. Orthopedics began to expand as a field. Instead of just children, it expanded to adults. Arthroscopy, joint replacement, spine procedures, trauma care, all of these things were developed mid-century in the 1900s. And as the field expanded, the hospital needed to expand. So in 1955, my father, J. Vernon Luck, was recruited to Orthopaedic Hospital. And he had a vision that we needed a new hospital, a modern hospital. So he convinced the board of directors, somewhat with some difficulty, to build a new hospital on the same site. And that hospital was completed between 1958 and 1962. In 1998, we entered into an alliance with UCLA that involved building the third orthopedic hospital. And today we have the Santa Monica UCLA Medical Center and Orthopedic Hospital in Santa Monica. And we have our outpatient clinics at our research center here downtown. We also built a state-of-the-art research center on the UCLA campus, the Orthopedic Hospital Research Center. And we built a new outpatient clinic building here downtown. So we can see more children than ever. In 1993, between 1993 and 1998, when we were looking for a strategic partner, culminating in the arrangement with UCLA, we were seeing about 25,000 visits a year, which is very large actually, for a center dealing with children with orthopedic problems. Today we see 55,000 visits per year. We have more than doubled. In addition to that, we founded with Los Angeles Unified School District the Orthopedic Hospital Medical Magnet High School. This high school is for children with interest in careers in healthcare. The kids all come from the inner city. They're a wonderful group. It is a magnet high school. It's a volunteer program. They don't have to be there. They wear uniforms. They are really very special. I'm very impressed with these young people, and it's really a thrill to be able to be involved in their education. With the Every Child Foundation, we established the Every Child Foundation Universally Accessible Playground. And that's here on our downtown campus, right next to the new clinic building. That playground is for children with disabilities and able-bodied children, so they can play together, so they can be comfortable with each other, and so they can feel the normal bond of friendship in childhood. It's a wonderful playground, lots of neat attractions, makes you wish you were a child again to go out and play that playground. So as Orthopedic Hospital enters into its second century, it really is an exciting time for us. We have greatly expanded our facilities, our mission, and the number of children we treat. We have expanded our research in cooperation with UCLA, as well as our own research in biomechanics, which is now world famous. We have expanded our educational programs. We are responsible for the residency program, the Orthopedic Hospital UCLA residency. We have expanded our high school activities with the high school. And we have expanded our activities with our support groups. None of this, from the very, very beginning, would have ever been possible were it not for volunteers and philanthropy. Were it not for people who cared and were willing to contribute their time, their talent, and their money. Going back to the group of ladies that Dr. Lohman recruited, even look at Dr. Lohman himself, going back to the first board of directors and every board of directors and trustees ever since, have contributed tremendous time and ability. These are leaders in the business community. We've been very fortunate to have this quality of person, and they have been responsible for helping Orthopedic Hospital advance. So we're excited about the second century. We fortunately are stable financially, but we can't continue without your help.